thanks for joining us today and welcome to our Women's Health Epworth Live series. I'm here today with obstetrician and gynaecologist Dr. Marcia Bonazzi. Thank you so much for joining us. Today we're going to be talking about the move from pap smears to cervical screening tests. If you have any questions you'd like to ask, feel free to pop them in a comment below and we'll get back to them as soon as we can after the video. I'll start by getting you to introduce yourself and tell us a bit about what you do.
So hi everyone, my name is Marcia Bonazzi. I'm an obstetrician gynecologist working in Melbourne, and I do deliver and operate at Epworth Freemasons and other hospitals, and I work once a week at the Royal Women's Hospital. I have been doing this for 30 years and it's a pleasure to be here to discuss the new pap test with this lovely young lady here.
Thank you. Thanks. So first I'll start with, what is the difference between pap smears and the new cervical screening tests?
The old pap smear we used to collect on a slide and check for changes on the cervix. The new cervical screening will look for the oncogenic means potentially cancer-causing strains of the HPV. If any of them is found, then we look for the change in the cells. Basically, it's like this. In the past, we used to look for the abnormal cells on the cervix. But now we know that what caused these abnormalities, how long the virus has been there. And this virus, most of the time, is clean after 1 year. So what they discover is we test, when we do the next pap smear, it's the same collection, same way that we used to do before. Same examination. Then we put on a container that is a liquid. First of all, they will check if you have this virus there. If the virus is present on your cervix or your vagina, the pap smear is done at the same time. If you don't have the virus, no pap smear is done, because we know if you don't have, the chance you're going to develop cancer in the next 5 years is very small.
Okay, and why have these things changed? Are the new tests more accurate?
Much more accurate, because we are looking for what caused the abnormality. Before was looking for the abnormality. So in reality, we are trying to screen already people that will be at high risk of developing the abnormality.
Okay. And how will the new tests affect the rates of cervical cancer?
Look, the test looks after the HPV that causes more than 99% of the cervical cancers. All the evidence suggests by doing that we have the potential of improve our pick-up rate of cervical cancer. When the main goal is to pick up very early stage, because late can be too late. And this was never picked up by the pap smears. So now we are going to pick up the HPV and know that's what can cause cancer much earlier.
Okay, and if you had a vaccination in high school, do you still need to get the test?
Yes. Under the new the previous program in 1991, with good participation rate, we are able to decrease the incidence of cancer by 50%. However, has changed since 2001. It's estimated with the new program, we'll be able to decrease the number of cancer deaths by probably 30%. So it's, even if you do have the vaccine does not cover against all the types of HPV. So you still need to have not the pap smear, the HPV, the cervical screening. So you still need to come back, because unfortunately we don't have a vaccine that covers all the types. Okay, but the good news is that if you don't have enough of them, instead of see us every 2 years, you're going to see us every 5 years. And you're not going to be request to have one if you have the vaccine until you're 25 years of age.
So start having the tests at 25 and then 5 years
every
from then
5 years
if
from
it's normal. Yeah. And I guess taking a step back, what is HPV?
The HPV, stop a little bit. Can't stop. Where is it? HPV stands for the human papillomavirus. There are 50 different types of this virus that doesn't infect only the vagina. You find on the genital and oropharyngeal area and oropharyngeal areas of the body. Of these, 14 have the potential of cause cancer. More than 80% of people are infected with one or more of these 50 types during lifetime. Overwhelming. Most people will clear this virus after 1 year. So we tell them not to be so stressed because theoretically you should be cleaning this. In a minority of the cases, someone does not clear this virus. In this case, the virus may integrate with the host cell DNA and become persistent. We call this integrating infection. And the integrate PV infection, which only occurs with one of the oncogenic types, and usually can take 10 to 20 years to become cancerous, but it's good that we detect on the beginning.
Yeah. For those of you who have just tuned in, if you have any questions for Dr. Marcia, feel free to pop them in a comment below and we'll get back to you as soon as we can. So how many strains of HPV will the test detect?
The new test looks for 14 types, oncogenic ones, or potentially causing strains of HPV. It specifically report the types 16s and 18s. That's the two most oncogenic types. And these type 16 and 18 together are responsible for 80% of the cervical cancer. So even if we are not picking up all the types, we are picking up the two ones that cause most of the cancer.
And if you do test positive for HPV, what happens next?
If you test positive for HPV, immediately the new test will do your pap smear. If the pap smear is normal, you can rest more relaxed. With the new protocol, if you have enough type of HPV, the new test will tell you if you have number 16, 18, and there are other types that are oncogenics but not so strong as the 16, 18, and will be reported HPV not 16, not 18. So that's what the test you're going to receive. If you are positive, then the pap smear will be done, and then we'll decide if you're low grade, high grade, if there is any cancer. Very unlikely that with the new generation had the vaccine, we are going to get so early abnormality so high.
Yeah. And what if you contract HPV in the 5 years between tests? Will it be too late?
No, because usually you can clear in 1 year, and we know that the chance that you have HPV and becomes cancer is only 10% in 5 years. That is the 5 years was expected. It's very, very small.
Okay. Is it possible for there to be a false negative on a test?
Yes.
Yeah.
Okay, false negative, yes. False negatives can occur in any test. False negative HPVs are very uncommon, less than 5%. So in comparison to false negative pap smears, there could be 30 to 50%.
Wow, yeah.
Remember, this time we check the gene of the virus.
Yeah.
Very unlikely we are going to miss or give you a false negative because it's the genes.
Okay. And what is cervical dysplasia and how common is it?
Cervical dysplasia means the changes on the cervix, and that's what the virus does. The virus has attraction to the cervix. That's the alteration on the cell that can cause dysplasia. Okay? In the previous program, we found that 94% of the pap tests were negative. Only 5% were low grade, which usually reflect an acute HPV infection, and less than 1% show significant cell change.
Okay. And how common is cervical cancer?
Very extremely rare in a woman under 25.
Okay.
As we start at 25.
Yeah.
Screening this age group intensively over the last 25 years has made no difference on the number of the cases reports annually. That's the reason that with the new program we have decided to increase the age for 25. Very rarely you see cervical cancer on a woman under 25.
Yeah.
More now in the last 10 years, most of the biggest proportion of these girls have been vaccinated with Gardasil and has been protected against the 16 and 18. That causes 8% of the cancer. So this generation is very lucky.
Yeah.
Mainly now because we are vaccinating the boys
Mm-hmm.
in the last 2 to 3 years.
Oh, yeah, of course, yeah. And how will I be prompted or reminded to have a test?
You're going to receive the new Telstra National Cancer Register will send you reminders to women 3 months in advance of the due date. And usually if you have with a gynecologist, It's our protocol to send them a letter as well. Was a letter before. Now they probably they will end up sending a SMS,
Yeah.
but it hasn't started yet. At the moment, everybody's receiving a letter.
Okay, great. That's good to know. And does the new test feel any different, or is it the same?
Unfortunately, not. They have done everything except change the same procedure.
There we go. And how long will the results take to come
1
through?
to 2 weeks, because in the past we used to have several labs. Now they are trying to concentrate the tests in not as many labs, because we are not doing many pap smears. It means the experts are decreasing in number of doctors doing. So 1 to 2 weeks. Before we used to have sometimes 1 to 2 days, so now it takes longer.
Yeah. Does the test check for non-HPV related cancers?
No.
No, just HPV. And what symptoms should we look out for in non-HPV related
Most
cancers?
important is bleeding. Bleeding after sexual intercourse, bleeding after menopause, and unexplained bleeding before periods. It's the main thing that everybody has to look for the doctors.
Okay. And is Australia the first country to bring in these changes?
The Netherlands was the first one to introduce before us. Okay, but the vaccine was developed in Queensland, University of Queensland, by Professor Ian Fraser.
Well, thank you so much for your time today, Dr. Marcia. We really appreciate it. And thanks to everyone who tuned in. We'll see you next time.